Okay. Tell me what you've seen as far as Latinas and teenagers getting pregnant. And tell me just some experiences that you've seen. And first off, do you see a lot of Latina teenagers who are pregnant?
I actually do, and it makes me kind of sad to see that, just because I know that, you know, further down the road it's going to affect their lives. But I do actually see quite a few, and because I do a lot of prenatal care and I do a lot of the pregnancy confirmations, I probably see the majority of them in this practice.
What is that experience like when you tell them that they're pregnant, you confirm that they're pregnant?
Most of the time they're happy. Most of the time they're happy. Occasionally they're shocked and they're like, oh, I can't do this, you know. I can't tell my parents, I can't, you know, whatever. But most of the time they're happy. And they usually come with their mother or a sister. And that person is also happy, which kind of surprises me, because I know as a parent, if I had a teenager that was pregnant, I probably wouldn't be so happy about it, you know?
Right. Why do you think they're happy?
I don't know if it has to do with the culture, that, you know, it's something that's very accepted by them, that they have their children young. I don't know if that's what it is or what, but or if they just don't realize the implications on their education and their future life, that they're kind of, you know, I mean, not that children are bad, but they do kind of slow things down for you. If you want to go to college, well, you know, it's kind of hard when you have a child. You can do it, but it's a lot harder. So
do they ever tell you, or is the conversation ever geared towards the father of the child, whether or not?
Sometimes the father of the child is very involved, and sometimes they're very young too, like 14, 15 years old too. Sometimes they're older, and that's been my experience, is they tend to be older, at least 3 or 4 years older than the girl. Okay. And sometimes the fathers come, and sometimes they don't. Sometimes they're involved, sometimes they aren't. A lot of times they are in Mexico, and they can't cross the border. So that, you know, there they have that complication too in their lives of, you know, the father down there, the mother up here, you know, it's just kind of a...
And you get to work with them throughout their
pregnancy?
Throughout
Yes.
the pregnancy. And what is that like, being so young and such a new experience?
It requires a lot of education, because a lot of them don't understand what's going on with their bodies. They don't understand what's normal, what's not normal. And they are very, very influenced by their mothers, which is fine. Mothers can be, are a great thing. I'm a mother, so I know that, you know, it can be a great thing, a great source of education for your children. But a lot of these mothers also have the old wives' tales, that that's what they believe. And so these girls are coming in and saying, well, my mother told me I couldn't do this, I couldn't do that, I couldn't eat this, I couldn't eat that, which is not true. And so it requires, you know, me educating them that, you know, that is not true. It hasn't been, you know, shown. It's an old wives' tale. This is, you know, I have to learn about old wives' tales. Where do they come from? What's the basis of them? And you know, it's a learning experience for me too. And the fact that sometimes they come and I'm like, oh, I don't know that one. You know, let me look it up for you and I'll find out.
And I have a kind of a follow-up question. Before they find out they're pregnant, do you ever see these girls at all?
Sometimes we see them for birth control, and then, you know, obviously to me that's a good thing, because they're showing I shouldn't say that's a good thing. I should say that is an okay thing in my mind, because if they're going to have sex, I'd rather them have it and be protected against pregnancy if they don't want to get pregnant, which I hope they don't. But I would rather them not have sex to begin with at a very young age, because that sets them up for a lot of other things. But usually I don't see them before that, unless they are here for birth control, and then I won't see them maybe till they're, you know, in their 20s, when they're now married or whatever, and now in a relationship that they want to, you know, have a baby, which is, you know, a better time in their life probably.
Do you see them again after they've been pregnant once?
Oh yeah. Yeah, I have one right now that she is, I think she's 16 and is having her second baby. I have an 18-year-old having her third baby. So, yeah. And you try, you know, when they come for their postpartum visit, to get them on birth control, and sometimes they do, sometimes they don't want to.
Do they tell you why they don't want to get on birth control?
They just don't want to. They don't usually have a good reason. Most of them will say they're going to do something, and so you give them a prescription for birth control pills, or, you know, whatever, and then they just stop taking them, or, you know, don't take them how they're supposed to, even when you explain to them how to take them. So,
does the subject of like condom negotiation ever come up? Like
using condoms?
Yeah, asking their you know, boyfriend or...
Some patients will, especially if they bring the the man with them, they will talk about condoms. Most of them don't. That's not like even an option for them. They just don't want to deal with that. So
Yeah.
they don't even if you bring it up as the practitioner, bring it up to them, they're like, no, I don't want to talk about it, you know.
Yeah,
Okay.
well, I think,
well, you should be using it anyway just to save yourself from getting a disease, you know, but
yeah. Do you think, why do you think they don't want to talk to their partner about condoms?
well, first of all, I think it has to do with their age. I think that they are, you know, as a young person, talking about sex is probably harder in a relationship like that where it's not a long-term relationship, as opposed to someone like me who has been married for 30 years. You know, it's much easier for me to talk to my partner about sex and about, you know, my likes, my desires, my wishes, as opposed to, you know, okay, well, how am I going to talk to him about that? Especially if they're older. Some of these girls, I think, feel a lot of pressure from the older boyfriends, and the older boyfriends will say no, you know, and they don't pursue it.
What, if you can remember, what was one instance where you really wished the girl was not pregnant at the age that they were?
I've had a few of them. I had one girl that she came in and she was 15, very, very immature herself. And her mother wanted her to have an abortion also. And by talking to her, she, to me, did not seem mentally equipped at that point to have a baby, or emotionally equipped to have a baby at that point. And I said, you know, I normally don't really advocate for abortion, but I think in your case, you might want to really consider it, because I think you need to grow up a little bit more before you have a baby. And her mom was in total agreement, but the girl did not want to, and so she ended up having a baby, and I haven't seen her since she had her baby, but
Wow.
so, yeah.
When a child has a child that young, or I should say when a 14, 15-year-old has a child that young, what happens to their body? What,
Well, a lot of them end up actually with C-sections because their bodies have not matured enough, their pelvic bones haven't matured enough to have a baby. Although I don't see it as much in the Latina population, because they seem like they mature faster as far as their physical development goes. But, you know, it changes them completely. A lot of them don't realize that, you know, their breasts are going to grow, and then when they are done with breastfeeding or whatever, they shrink, and then they sag, and then they have stretch marks, and, you know, they don't realize all of that, and they don't like those changes, which then leads them to the cosmetic surgery route later on.
yeah.
So, because they don't like that, they're like, oh, I didn't realize this was going to happen. You know, they're especially concerned about their breasts. They don't care so much about the other things, but their breasts are a big thing. You know, oh, now they're saggy, and now they feel smaller, and, you know, what do I do?
Do you find that their moms are young also?
They tend to be young also, and from what I've seen, most of them had their children also when they were like 16 years old, 17 years old also. And I don't know if that goes along with them being more accepting and happy about their daughters, you know, being pregnant at a young age, because, oh, they're following in my footsteps. I don't know if that's part of it or not.
Any last thoughts you want to say?
I wish that we could, you know, stop this whole, you know, teen pregnancy, because it's, to me, it's an epidemic, and what I see is that it is a pattern, generation after generation after generation, and I think socioeconomically that doesn't help us as a population as a whole. And I think there are so many opportunities out there for women, and for Latina women especially, that these girls are going to be missing out on unless they are super determined and super motivated to get their education and make something of themselves having children. And like I said, it can be done. It's just very, very difficult. And I just see that they, you know, they struggle. I do have to say, when I was in private practice before I came to this clinic, I had a patient that I've seen her since, and she's now 22 or 23, and she had her baby when she was 16. And she told me, she told me from the beginning, I know that I'm going to have a hard time graduate from high school, I'm going to have a hard time going to college, but I'm going to do it. I'm going to show you that I can do it. And I said, you know what, I believe you. And she did, and now she's, you know, got her degree in something with computers, and, you know, she's very, very motivated. She was very motivated from the beginning. But now I don't see that. She's the exception more than the rule.
Yeah.
What I see these girls is they say, okay, well, Medi-Cal will take care of me, welfare will take care of me, my mother will take care of me, and a lot of the mothers do end up basically raising their grandchildren, and, you know, that makes me very sad that these girls are missing out a lot on, you know, other opportunities that they have. I mean, the door's open for them, and it's basically like they're shutting it. So,
Thank you.
oh, you're
Thank you
welcome.
so much. I'm
You're
gonna
welcome.